Tim?
Yeah, there is a very remarkable on page 2, very remarkably low nursing home care entrance, right down the bottom, almost down the bottom. Now, the people in nursing homes are very, very old. They're visited by doctors quite frequently. I think they get very good service from the local doctors. But the message I seem to see with old people is once they go into hospital, the doctors don't want to touch them, because if anybody dies under their hands, you know, it's recorded on there as a patient who's died. So obviously they then become a more lethal surgeon. And so as far as I can see, they just ship them back again. So, you know, naturally there is a reluctance to go into hospital. If all that's going to happen is you're going to be left in a bed to see whether anything develops. If not, you're sent back again. So rather wasted exercise in some cases. The second question is, we haven't covered it here, but as I understand, we've got a lot of obesity here. Now, obesity leads to all sorts of problems. You're looking at what's happened in the past. Obesity is building up. So how are you addressing, there's nothing in here I can see about it. How are you addressing that? Because that's going to lead to diabetes, it's going to lead to all sorts of problems, and it is something that's going to cost the NHS quite a lot of money.
With respect to the nursing homes, certainly that we've got in place quite a few different strands, different ways of engaging with nursing homes. We're just starting up a service where we have iPads in nursing homes, so that we can talk to them and actually have a better dialogue on a regular basis. All the nursing homes have link nurses who will be able to give assistance and advice. We have training directed towards the nursing home staff, so that they're able to identify and preempt problems that crop up. So we always see that nursing homes need extra special input into that. By and large, I think you're absolutely right. And those people who are there are extremely frail, and there are great risks about taking them into hospital and operating on them unnecessarily. But I think you've also got to weigh up the pros and cons of not doing anything. And at the end of the day, it's the patient's inalienable right to say, I want you to be heroic, or no, I'm willing to accept the consequences. So it's that all of us have that right to make that informed decision, and certainly that's something that we support quite considerably. We're trying as well to get those conversations as early as possible and record them in a place that other people can see them as well, so that when the ambulance service or the out of hours go out, they're able to see that conversation's happened, and that place of care and the type of care is the right for them. There was a second question.
Obesity.
Obesity.
Problems with that, diabetes.
It's then, if you look at the trends, certainly the obesity, the rise in obesity has been quite steep. I would say that if you look at the statistics, it is flattening off already, and if we did absolutely nothing, there is the statistics, the mathematicians would say that the problem is going to get less with regression to the mean. However, I think we do have to be very clear that obesity has a variety of different issues. You mentioned about diabetes, heart disease, dementia, cancer. They are all very key to your overall weight. A 20% reduction in calorie intake reduces your risk of dementia quite considerably. And yet this is something that, by and large, we're not actually getting out there, the message-wise. We're working with schools, with healthy schools. We're working with our public health colleagues, Public Health England, and we have a public health consultant who's on our board. We've got quite a few messages and ways to help tackle that, and the healthy living and the healthy schools program is being rolled out. Our clinical navigators are directing people towards ways of helping in this respect. We have what's called Tier 3 and Tier 4 weight management services directed at those people where that hasn't been effective. So there is an enormous amount of work, but it's not just in our gift to do this. I've talked to Councillor Baker about an excellent TED talk where the council in America went and made it difficult for people to do the wrong thing and easy to do the right thing. So it's making it easy to take public transport, to go walking, to go cycling. You make it difficult to park right outside the shops. Those are the things that won't get you re-elected, but may get you a healthy population. I'm not selling well, am I?
Thank you.